Assalamu alaikum. Hello my dear students, hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy, Addin Women's Medical College. You already know that we have already finished the defined process and the dissection on anterior and the medial compartment of the thigh. Today I will discuss about the procedure that how you can proceed to the dissection of the anterior and the medial compartment of the thigh. We will see a live video. First of all, let me tell you that whenever you are doing the dissection, you need to know that what are the muscular, nervous and the vascular compartments or the organization of the medial and the anterior compartment of the thigh. Remember, at the anterior compartment of the thigh, we have different group of muscles. The common muscles which are very obvious, firstly, that is a oblique muscle, a very long muscle, that is called the sartorius. Then a group of muscle compact together, that is called the quadriceps femoris. Under quadriceps femoris, we know that there is rectus femoris, vastus medialis, vastus intermedius and the vastus lateralis are present. At the same time, in the medial compartment, we know the muscles are adductor longus, adductor brevis, adductor magnus and also a elongated muscle which is called the gracilis. We also know that the anterior compartment is mainly supplied by the femoral nerve, and the main vessels that is present in the anterior compartment is the femoral artery and the femoral vein. On the other hand, the medial compartment is mainly supplied by the obturator nerve, and the vessel is also again the branches from the femoral artery and the tributaries of the femoral vein. So let's see the step of dissections and what we will see underlying the skin of the anterior and the medial compartment of the thigh. Not only that, we will see a little bit description about the femoral triangle as well. So let's start. In this video, you can already see that this is the thigh. Now, we will see that what is the organization and how you will do the dissection. First of all, you can see this is the lateral aspect of the thigh. This is the medial side. Over here, the inguinal region, and this is the knee area. Now, the first incision is made along the inguinal ligament, then a vertical incision is given all through the thigh and it is going up to the forefinger breadth below the knee. So, whenever you are doing the dissection, remember you do not put the dissection so deep that it can injure the superficial structures. Now, we are reflecting the skin along with the superficial fascia, which you can see the yellow color structure is reflected laterally. The first deep fascia that we can see is the fascia lata. We can see that this is a membranous like structure. This fascia lata is the deep fascia of the thigh, which is little bit thicker at the lateral aspect, which we can see over here, and this is called the iliotibial band. This iliotibial band is actually having two muscles. As you know that iliotibial tract or iliotibial band is having a muscle that is called the tensor fascia lata. From this window we can see a muscle which is present anteriorly. This is the tensor fascia lata. The function of the tensor fascia lata is basically, you know, that the flexion and the medial rotation of the hip joint. It is considered to be a muscle of the gluteal region. Posteriorly, there is another muscle which is called the Gluteus Maximus. You know that in the iliotibial tract we have two muscles, tensor fascia lata and the Gluteus Maximus. Over here we can see a very long vein that is passing through the superficial fascia, and you know that it is called the great Cephenous vein, and this great Cephenous vein is coming from the medial aspect of the foot and crossing the knee, and then it is going at the middle aspect of the thigh, and ultimately it is draining into the femoral vein over here, we can see. Now, we will see what are the muscles. The first muscle, which is over here, it is called the Sartorius muscle, a very elongated muscle. This Sartorius muscle is the longest muscle of the thigh, and also it is doing so many functions, like in the hip joint, it is doing the flexion, it is doing the weak abduction and also the lateral rotation. At the same time, at the knee joint, it is doing the flexion of the knee as well as medial rotation of the knee. So, it is also known as the rider's muscle or the tailor's muscle because of its cord-like structure. and it is coming from the anterior superior spine and it is going to the upper part of the medial aspect of the tibia. Now over here, this group of muscle, as I said, these are the quadriceps muscle. These quadriceps muscles are having the rectus femoris, vastus medialis, vastus intermedius and vastus lateralis. Now these muscles are having a common insertion by a common tendon. Over here we can see the vastus medialis, which is doing the knee extension. This is the rectus femoris, this is the vastus lateralis, and underlying the rectus femoris you can see the vastus intermedius. They are the powerful extensor of the knee joint. Now they are having a common tendon over here, which is called the quadriceps tendon, and this tendon is actually giving insertion to the upper border of the patella, and then it will be continuous as a patellar tendon and it will ultimately go to the tibial tuberosity over here. This patellar tendon is really strong, or sometimes it is known as the patellar ligament. So these group of muscles are having a common insertion to the tibial tuberosity. Rectus femoris is also having some actions on the hip joint just because it is coming from the ischial tuberosity. And Sartorius is also having action on the hip joint, as we have already said. Now let's see what is present over here. We will do some zooming in so that we can see the structure a little bit more clearly. Over here you can see that these are the muscles of the medial compartment of the thigh. This is obviously the adductor longus muscle. The main function of the adductor longus is hip adduction, as it is an adductor muscle. Then we will have the pectineus muscle over here. This is the triangular pectineus. Now this is the adductor brevis. Along with the obturator nerve over here, we can see branches of the obturator nerve. Then underlying them, most deeply placed, a very large muscle which is called the Adductor Magnus. We can see that it is mega size. And lastly, this is the gracilis, a very long muscle, just like the Sartorius. This is the gracilis. All of them are doing the adduction of the hip joint. Now another structure which is present over here at the Adductor Magnus region, this is called the adductor hiatus. This adductor hiatus is having the femoral artery and the femoral vein that is passing through this hiatus and going to the posterior compartment from the anterior aspect. These are structures. Now over here we will see some amazing structure, like three muscles from the three compartment will merge at the same place. This is called the pes anserine tendon. In your book you have read about the guy ropes that three tendon from the three compartment of the thigh will come into same place. This is the tendon of the Sartorius, this is the tendon of the gracilis, and this one is the tendon of the semitendinosus. So you can remember, say grace before T. S for Sartorius, G for gracilis, and T for semitendinosus. Combinedly they are forming the guy ropes. Now we will see the boundary of the femoral triangle. Remember, this is a triangular space, as you can see. Over here, this is the Sartorius muscle. So femoral triangle is bounded laterally by the medial border of the Sartorius. It is bounded medially by the medial border of the adductor longus. You can see this is the adductor longus, and The base of this triangle is formed by the inguinal ligament. You can see the inguinal ligament over here, and the apex is the meeting point between the Sartorius and the adductor longus. This is the femoral triangle, and we can see the structure. Pectineus, this is the iliopsoas muscle. These muscles are forming the floor of the femoral triangle. Iliopsoas is mainly doing the hip flexion. And now we will see the structure, which is very much obvious in this triangle. And let's see what are the structures. Remember, all these structures are having a definite position. Laterally, you can see the femoral nerve, then the femoral artery and the femoral vein, and most medially there will be femoral canal over here. So you can understand that these structures are arranged chronologically, like first laterally nerve, artery, vein, and this space is having a canal that is called the femoral canal, which we mention as internal. So navi is a word that you can use to remember the structures. Now this femoral nerve is having so many branches because it is supplying all the muscles of the anterior compartment. One of the largest branches, which is cutaneous, and this nerve is called the Cephenous Nerve, and it is passing just like the great Cephenous vein. You can even see that this nerve is passing along with the great Cephenous vein over here, and it is going to the leg as well. This is a very long cutaneous nerve. Then another nerve we can see, as we have already seen, that this is the obturator nerve. These muscles, all the adductor muscles are supplied by this obturator nerve. And over here you can see the obturator artery, that is the one of the source of artery supply of the adductor compartment. Most of the artery supply is coming from the femoral artery over here. You can see very long femoral artery which is passing through the adductor hiatus or adductor canal to go into the popliteal region, and then it will be termed as popliteal artery. This is the popliteal vein, that is the femoral vein actually, going to the popliteal region to convert into the femoral vein. So it is having some surgical importance. Now one of the very large branch of the femoral artery which is going to the posterior compartment, it is the deep femoral artery or Arteria Profunda Femoris. It is having two branches. You can see lateral circumflex femoral artery over here and the medial circumflex femoral artery over here. You can see that Profunda Femoris is having some of the perforating branches. These perforating branches are going to the posterior compartment to supply the muscles of the posterior compartment of the thigh. So let's see some of the quizzes. If you can identify what is this muscle, obviously vastus medialis, this is the rectus femoris, this one is the adductor longus, and this one is the gracilis. Now if you want to identify the muscles over here, you can see that this one is the iliotibial tract and this one is the rectus femoris again, because this is the sartorius. Over here you can see this is adductor longus, this is the pectineus, femoral nerve, femoral artery, and the femoral vein over here. This is the inguinal ligament. So my dear students, from this video we can see how you can do the dissection and what type of structure you will find when you are going through the dissection of the anterior and the medial compartment of the thigh. In the coming days we will see the video of dissection of the anterior and the lateral compartment of the leg and also the dorsum of the foot. Stay safe, Be safe and take care. Thank you.